Every woman.
Every child.
Every adolescent.
If all the world's women, children, and adolescents are healthy, the odds are good that everyone else will be too. That's why in 2010, the United Nations launched the Every Woman, Every Child movement and a strategy to mobilize and intensify actions taken.
By governments, businesses, civil society.
And by the United Nations and other partners.
Actions to end preventable deaths among women.
Children.
And adolescents.
And to do it soon, within a generation. The effort is building on progress already made. Since 1990, maternal deaths have dropped globally by 44%. The death rate for children under 5 is less than half what it was then. And since 2000, the adolescent death rate has fallen by about 17%.
The global strategy also focuses on improving the quality of our lives so we can thrive and help transform the world.
By making sure girls and boys have the care, love and support we need to be everything we want to be.
Yes, and you'll see that that can take many forms as you grow up, from healthcare to empowerment. Ensuring access to sexual and reproductive health services and rights for everyone, everywhere. Progress is not always easy in a world where setbacks from war, climate change, and epidemics are common.
So what can we do to make sure progress is happening?
The movement is mobilizing support for women's, children's and adolescents' health. It's also bringing partners together to look at what's been achieved and what can be done better. Ministers of health from all over the world have committed at the World Health Assembly to take forward the implementation of the global strategy and report on progress. Toward that end, the World Health Organization has created a data portal to keep track of what's working and what's not.
Don't we already know what works?
Big knowledge gaps exist, but by building on previous successes, we've gotten a big head start towards reaching global goals.
I learned about them in school. Goals like ending poverty and protecting the planet and making the world a better place.
Yes, and goals like ending child marriage, because girls who marry are less likely to finish school and more likely to suffer complications or even die during pregnancy or childbirth. They're also more likely to be poor when they grow up.
I studied that too. 14 of the countries with the highest rates of child marriage in Africa are taking steps to end it. That's good for everybody.
Every Woman, Every Child partners are supporting these and other programs, like training midwives, improving education and nutrition, and providing community counseling and better access to clean water and sanitation. In the last 2 years, low and middle-income countries have pledged nearly $9 billion. In all, since 2010, partners have invested more than $45 billion.
The health and well-being of women, children and adolescents are improving faster than ever before.
So the problem is solved.
I wish, but no, there's still much to be done. In 2015 alone, more than 300,000 women and girls died from preventable causes during pregnancy or childbirth. Nearly half of all women who gave birth received no postnatal care at all. Nearly 5.6 million children under 5, that's 15,000 a day, died. And 2.6 million, 7,000 a day, were stillborn. Most of these deaths could have been avoided.
That's not fair.
No, it's not, but we can all help. It's our future and we all must do our part, so that women, children and adolescents can create a better future and help transform the world.
Together, we can make a difference.